Dr. McMacken, if you could come back up. We have a few minutes to take some questions from the audience, if you have some for these wonderful clinicians. Thank you so much. And Rachel, yes.
Hello, I enjoyed your presentations very much this afternoon. A lot to learn, a lot of good statistics to pass on to my PT students. We're doing the, back here, we're looking at the Zoom link and seeing if there's any questions that comes in. One of the questions that came in, there's a lot of nurses or nursing students watching this on Zoom, and Dr. McMacken, when you were talking, some of them said, what about nurses? What about nurses? And then, of course, you answered the question even before the end of your talk, because you said with the new program across the 5 boroughs, you would be implementing nurses. I want to put in a plug for physical therapy as well, because I see you have exercise trainers, but you know, at a place like Bellevue, as an example, they have a whole staff of physical therapists. You could have them rotating through your clinic. I'm sure some of them would be glad to do that. So I'm just putting that out there.
I personally would love to have, there are so many different disciplines that we could include, and physical therapy is a great example. So I thank you for raising that, and I know actually the American College of Lifestyle Medicine has, you know, a whole track for physical therapists and an interest group for physical therapists, so they're a really integral part of lifestyle medicine, and perhaps in our phase 2 expansion.
Sure.
And I just want to add that every single person in this room has a role to play in building this movement. Obviously, I think a lot of us here are incredibly passionate about this field, but there are a host of other folks who would benefit from knowing more about this field, and that includes anyone in PT, that includes in a lot of different disciplines. And then just reminding, if you do not know one of the other plant-based advocates in the PT, Karan Dada, definitely should. So we'll make that happen.
Hi all, this question is more so on the data and research side of things. Is there a way you all are quantifying like dietary compliance for these patients to further the evidence that, you know, you don't have to be 100% in this plant-based lifestyle to see results?
Well, so we are under-resourced in that. That's a great question. It will be wonderful to have that. The way that I'm able to track it, which is exquisitely crude, is I will ask patients what percentage do they think their diet is plant-based or to the degree that we had discussed. And that's what I'm able to track anecdotally. If they are 50%, if they say 50% or more, I start to see clinical changes. And for our research study, where we're going to be giving them the food, they're going to be sending us pictures of what they eat. I mean, you know, 3 in the morning, if they're home, they could have whatever, and we're not going to know. But that's what we're going to try to do. But that's what we're going to do.
Thank you.
Hey, question. My name's Sam. I am a dietitian here at Downstate and also a mindfulness instructor for the doctors, med students, and food service staff. On the patient side, a challenge I have is, you know, giving these recommendations for a plant-forward diet and then patients not being able to access those foods. Our closest grocery store to here is Key Food, a very sad produce section. People are busy, they're working multiple jobs, and so if they need to get a prepared meal, their options are also very limited. And so, Rachel, that's maybe more of a question for you with food policy, but how do we actually make these foods accessible to the community?
Yeah, it is a larger question that we, with the Department of Health and their Shop Healthy team, are kind of thinking really actively about. It's something that, you know, the mayor also wants to show that you can eat healthy from a bodega. You can eat healthy, getting the frozen food that's at the key foods. Sometimes we ourselves kind of perpetuate that myth of, a sad produce section equals equals an inaccessibility barrier. And I do want to put a pause in that sort of mentality because I think it perpetuates us not being able to say, eat more plants. Here's the small ways that you can incorporate more plants into your diet as a whole. But it is a larger question that we have just begun to scratch the surface of, and you will be seeing the administration dedicate our time to a lot more throughout the next few years.
I mean, it's wonderful that we have Ms. Atchison here with us. And yeah, I probably agree with you, that is a larger societal question. And there's unfortunately data that even if you say there's a food desert, if you will, and you put a supermarket there, you have a nice produce section, or have the healthier access to the healthier foods, it doesn't mean it's going to get eaten. That's unfortunately been proven time and time again. So we are really going to have to work on ways to make the healthy choice, the easy choice, and the desirable choice.
Thank you.
So first, let me thank all of you for coming and for your contributions. Dr. Osfeld has created, they've all created sort of silos of sanity and plant-based excellence and enthusiasm. Dr. Osfeld in the Montefiore system, McMactin through Health and Hospitals, and the fearless Rachel is taking on the entire city of New York, God bless. And the question I have for you is, the more I get involved in this field and work with ACLM and others, the level of ignorance might be a kind word, but a lack of understanding of plant-based medicine, particularly by physicians, is very apparent. Even within primary care, whether it's PrevMed or Family Med or internal medicine, there's a lot of folks who don't have any idea what this is. And then you get into the specialty levels, and there was a billboard in Brooklyn that said, forget about it, they just don't know. So I'm interested in your experiences at the institutional level, the health and hospitals level, the city level. What do you encounter? Do people embrace what you do and doctors come up and say, great? Or do they look at you and say, what the heck are you doing and why should I even care? And how do you deal with this, this attitude that just seems so unfortunately prevalent now?
From my perspective, it's all the above. We see all of the above. There's some people that resonate to it right away, as you know, and there's some people that'll give you the Heisman for years. And it is a very large issue. There are people who are working to get nutrition-related board questions on various medical exams, which will make a difference in terms of what medical students focus on. We've been at this for a while now, and even in my 9 or so years giving the medical students a lecture about largely plant-based nutrition, they know, even now compared to 8, 9 years ago, they know a heck of a lot more about it. We are benefiting from a societal level wave. There's a wonderful study by DeVries that shows that about 90% of cardiologists say that they know that nutrition therapy is helpful, but about like 2% of them feel comfortable giving nutrition therapy. So there is an educational gap which could be filled by various CME events just like yours. So I think what outside of some sort of mandate of 10 hours of CME nutrition education a year, it's silos, just like you're saying, silos of change that hopefully have leaks and lift up other people as we go. You talk to your colleague in the hallway, this person talks to that person, we talk to the medical students, and next thing you know, half a generation later, things have really changed.
Yeah, I would definitely agree with that. I think our experience, specifically at Bellevue, has been colored by the fact that Dr. Sapna Shah, who was on the panel earlier, and I really launched. We had a fellowship. We had the opportunity to do a fellowship in nutrition and develop a curriculum for our faculty colleagues at NYU on nutrition. And so we started out with that. We started by teaching the faculty about nutrition, and it was, of course, a largely plant-based approach. And from there, we moved on to start teaching the residents and start teaching the medical students. And then we started moving on to teaching the staff in the clinic, the nurses, the diabetes educators, our medical techs. And so we had staff engagement events, we had plant-based potlucks, and so everybody got really engaged. And then when our residents see patients in primary care clinic and they go to precept with an attending for the case, most of us are on the same page and understand the value of nutrition and take it, understand it for what it is. And I think sharing the more that our residents have an opportunity to use and leverage nutrition and lifestyle in their practice, they'll start seeing changes in their patients, and that will convince them. The science will intrigue them, but seeing it in their patients will convince them. I taught an intern last year it was her first day in clinic, and she had a patient who had a new diagnosis of type 2 diabetes. And you better believe we talked about nutrition that day together. And she went back to the room, talked to her patient about a plant-based diet and exercise, and now that patient went into remission. Their diabetes went into remission, and a year later, she's still talking about it. She's like, I can't not talk about it when I see patients with diabetes now. I'm like, that's the point.
I have several things to say about this. We can talk more after for anyone who is interested in further thoughts, but a quick synopsis is I largely think that it's inertia. We have been conditioned to think that the medical healthcare system is one that is really a sick care system, one of prescribing, not of looking at the upstream, reasons. We have a financial system built around that. We also have a communication strategy problem. I think Rob was exactly on point around we don't have the luxury of having to talk about the ideal diet. I think the message that all of us have is eat more plants, and I think that getting that across in a unified comms way is one that we have struggled for a decade. It's not as if the science has radically changed in a decade, but that communication strategy has not progressed as fast as some of the programs. I mean, the fact that we're going from pilot to policy, from 1 clinic to 7 in the city is huge, but it doesn't, it's a drop in the bucket for what we need. And so actually this coming week, I appreciate the accolades, but Nate Sherpinsky actually is behind a lot of what I do. And so Nate is helping the Deputy Mayor for Health and Human Services convene a lot of hospital executives across the city. And Dr. McMacken will be presenting at that to get more of the non-H&H folks on board. I wish there was more examples like Rob with Montefiore, but sadly there's only a few right now. Excited for getting more, so that's just a little bit.
Hi, my name is Mare. I am a health coach and also an organizer for the Latin community in Plant Power Metro New York. I actually have 2 questions for all of you. The first one is, how do you see the role of health coaches in this movement, and if you see a role in it? And the second one is, I see the BMI in multiple studies, but also some people might show to have an overweight or obesity on your BMI, but they might just be, have a lot of muscle. Do you consider this to still be a good measurement of health on the studies?
So great questions. So regarding the health coach, well, I'm a huge fan. I know Chrisanne is our health coach in our program and has done an amazing job at really galvanizing change in our patients. And I think there is a role for health coaches and health systems around helping patients' action plan around the nutrition prescriptions from dietitians and the lifestyle medicine plan from physicians, and really doing that concrete work of helping patients understand how they can move forward with those action plans and guiding them. So I'd love to see more of that. Regarding your BMI question, I think that's, I'm 100% on board with you. I don't think that we can really necessarily judge a person's health by their BMI at all. I think there are definitely people who have what would be considered an elevated BMI who are in better health than someone who has quote unquote a normal BMI. And so there's many factors that go into health. I think one of the things that we have decided as a team on our program, we want to be very conscientious about is if a person comes to us, you know, who is in what would be considered an obese BMI category, if they feel fine and they don't feel like they have any health concerns and they don't, then that's okay. That's where they are. We know that independently, as BMIs go higher with obesity, there are definitely health risks, but that doesn't necessarily mean that by looking at someone, you can determine what their health status is.
Thank you.
Yeah, I mean, behavior change is the holy grail. We all kind of know that eating kale is good for us, but to get ourselves to do it doesn't always work. So health coaches can be wonderful at helping us make these kinds of changes. And yeah, I mean, BMI is a great research tool. It's not as great for an individual person. So epidemiologically it can be helpful, but of course, the person sitting across from you could be Arnold Schwarzenegger, BMI 35, or someone who hasn't exercised since 1970, you know, BMI of 35. So it's clearly not as precise for an individual person.
And then I just want to take a quick second to say what an integral role a grassroots organization like Plant Powered Metro New York has played in the ecosystem of New York City and plant-based nutrition. So one, thank you for your individual service, but two, I mean, thank you to everyone here who has spent time in progressing Plant Powered Metro New York's movement and vision, because you all have been a force to be reckoned with. So thank you for that.
Thank you.
I have a comment and a question from the Zoom chat. The first comment is to please be sure to include dentists in your team as well. People see dentists perhaps more than they see physicians. They have to go at least twice a year for their teeth cleaning, right?
There is room for everyone at the table.
I know. But this is just a comment from the chat.
I
Then
think
one-
the New York Knicks are joining Bellevue's team also, I'm not sure.
Of course. And then there's a comment, a question. Do you have any suggestions for maintaining currency in lifestyle medicine once the conference ends?
Maintaining what, I'm sorry?
I don't know who
Currency?
they were addressing. So
I think we all have a passion for lifestyle medicine after 5 p.m. today, so I think we'll just continue on.
And you know, it's funny with the dental health, I guess it's not funny, there's clearly a link between periodontal disease and a variety of other diseases, diabetes, poor obstetrical outcomes, suboptimal cardiovascular outcomes. There's a randomized controlled trial in the New England Journal of Medicine, I believe in April of 2006 or 7, where they took people with periodontal disease and randomized them to usual care or very intensive periodontal health care. And the intensive arm had improved endothelial function after 6 months, and that was their endpoint. And so actually, I have on my little checklist that I give patients flossing once a day.
Just for the currency question, I'll put on my ACLM hat here, but the American College of Lifestyle Medicine would welcome you as a member. It's not very expensive, and they have incredible free resources, ongoing educational opportunities. They have what are called MIGS, member interest groups, where you can get involved with like-minded individuals, whether it's by a specialty or a special interest, and have discussions. They have meetings, they have chat rooms, they have blogs. So look into ACLM if you want to stay, current.
And if you have not heard about their conference, the Conference on Lifestyle Medicine, it is a phenomenal conference that sadly for the past 2 years they've had to cancel for the in-person version. But I think this year they'll probably
It will be in the
resume.
fall in person.
So
yes.
I'm very excited, very excited.
Yeah, and one word on BMI. We talked about the high BMI, but the converse is that not everybody with a low BMI is healthy. There's something called TOFIs, right? TOFIs. Thin on the outside, fat on the inside. These are folks who are very thin, have a low BMI, but they have awful diets, they eat all the wrong foods, and inside their arteries are clogging and they're on a path to disaster. So BMI is a very rough guide.
Hi, good evening. My name is Shanice. I'm a night nurse, to be specific. noticed that a lot of people are asking different questions. And in reference to the programs that you're doing now and expanding to the other HHC hospitals, I'm presently at Kings County ER at nights. We know that those of us who work nights, we tend to not get any information at all. In fact, I got this information from my sister who works upstairs in the research department. She sent it to me, and then I saw Rachel's information and I texted her. But how can you make that information available throughout the HHC systems for us? Because you could see the difference in our weight for day shift versus night shift, and we are the ones who are eating late and doing those unhealthy practices, even for me who is plant-based. So how can you get that information available for those at nights, that we could get our community and our patients aware of the program that you have?
I love that question. So first of all, all of our programs are open to anyone in the community who meets our criteria, as well as any employees in our system or patients in our system. As far as getting the word out, I talked today about the expansion of these dedicated lifestyle medicine programs, but that's actually only part of my work in my role at Health and Hospitals, the nutrition and lifestyle medicine. And the other part is to meet the needs broadly of our patient community, for the whole Health and Hospitals community and our staff around health, nutrition and lifestyle specifically. So a great example, I'll bring up Lily Correa, our dietitian for our Bellevue program, who's now working with me as well. She helped put together for National Nutrition Month a series of webinars that were viewed by over 1,600 staff throughout all of Health and Hospitals, including discussions around plant-based nutrition in general, fiber, protein, and a cooking demonstration. So it was nutrition focused, but we're planning more events like that to really, and they're recorded and anyone can watch them, so you don't have to watch live. We have many other exciting things up our sleeves to help engage our staff in getting excited about eating healthier and finding out what they can do to support each other as peers in that, as well as other lifestyle changes.
Thank you so much. Thank you. Thank you.